Hello, I'm Dr. Lisa Kellett, and today we're going to be talking about mole removal. I will be doing a modified shave excision. And during this process, I will be taking up the mole and I will be talking about how we do it. This is a newer treatment. It's a very good treatment. It does not involve stitches, so it's great for the patient, heals faster, and also the mark that you end up with is much better. It is very, very important if you have a mole that you want to get removed to either see a dermatologist or a plastic surgeon. Every mole has the chance that it could be a melanoma or could become a melanoma. So you need to get a proper diagnosis, and every mole that you have taken off should be sent to the lab for histopathological examination. That means there's a specific physician who's a pathologist, and where I send my specimens, it's a dermatopathologist whose specialty is to look at moles underneath the microscope and make sure that there's no cancer there. That way you'll be safe, you'll know exactly what you're dealing with, and it's best for your health to do it that way. So let's begin. The first thing I'm going to do is I'm going to freeze it. So I'm going to clean the surface. And in my patients, I like them to be very, very comfortable. And I'll tell my patients, give me 5 seconds and I'll have this frozen. So here we go. I'll do the first one and a little poke, and 5, 4, 3, 2, and 1. That's all she's going to feel for the whole procedure. And again, 5, 4, 3, 2, and 1. Very good. So the freezing usually starts to take effect within about 15 seconds. So we'll let that freeze. I'll do a modified shave excision on this. I'm going to start from underneath. I just take a very small amount. After I take the moles off, I do send them once again for histopathological examination. And I also do something called electrodesiccation at the base. It basically means that after I take it off, it's going to leave a very nice result. Once again, I just like it to be perfect, nice and smooth, so that afterwards it'll be very, very difficult for anyone to tell where the moles were removed. Okay, so this is a nice one to see, just a nice close-up of how that came off. So there's the mole there. The mole site is gone. The mole itself is gone, and there's what you're left with. So the next step now, I could stop here, but as I said, I'm very picky with how I do things. I want to be perfect for her. I'm going to use some heat, something called electrodesiccation. And the electrodesiccation is going to help to make it nice and smooth. So I'm going to apply some heat here, and that's just going to burn some of the tissue here, and just to make it nice and flat. I like to flatten things out so it heals like a nice scab. And I tell patients it's going to take about a week to heal. At that time, she's going to use some Polysporin on it twice a day. No rubbing and no picking. That's the most important thing. She can, there are new guidelines. So if she has Polysporin at home, she can also use some Vaseline. So Vaseline petroleum jelly is fine as well. And that is always put on a clean Q-tip. Never touch your finger to the applicator of anything that you're putting on the skin if it's an open wound, because you do not want to contaminate the wound. So always use a clean Q-tip. Once that Q-tip touches the skin, you discard that. If you need to get more, use a clean Q-tip.